Hey everyone, Kurt Yaz here. In this video, we're going to be talking about the differences between a traditional healthcare plan, often referred to as a PPO, and a high deductible healthcare plan, often called an HDHP. And you're going to want to stick around at the end of the video because we're going to break down why you would want one or the other, and you could be saving yourself a lot of money. And this is important for you to understand because if you pick the right plan and you were to do this over years, you could save yourself potentially a lot of money. We're talking tens of thousands of dollars. And for a lot of individuals, one or the other one of these plans is going to be the best fit for you. So let's get into the meat of this and talk about the differences. So the best way I thought we could explain this is by breaking down the pros and cons of each of these healthcare plans. Quick disclaimer, I am not an HR professional, so work with your HR contact to decide what's best for you and your family. Always do your own research, double check things. This is for only entertainment purposes. So what is a PPO? Well, a PPO is a traditional healthcare plan typically. And what that means is for most people, you're gonna have a lower deductible where you essentially spend money out of pocket in a calendar year because they typically always start on the 1st of the year and on the 31st of December and reset for the next calendar year, is a plan where you have a fixed deductible for the year for out-of-pocket expenses. And typically the way the PPO is laid out, you have a lower deductible. So if you have a major situation, you often will pay less out-of-pocket off the top line initially. And then you have copay, and often you have coverage of medication and different sort of office visits are priced down with just that copay. The cons of a PPO is that you're gonna have a higher premium monthly to pay for your health insurance, and you're not gonna qualify for a health savings account, an HSA. And so all the copays you make, all the expenses out of pocket, any sort of out-of-network provider that isn't covered in your insurance, you're gonna be spending post-taxed dollars on those healthcare expenses. A high deductible healthcare plan, or an HDHP, is a HSA qualified eligible health plan, generally speaking, and you're gonna have a higher deductible. In my case, it goes from $1,500 to $3,500, and then that's kind of what you're on the hook for the annual year that you're gonna have to spend on medical expenses before that plan kicks into effect. Now, the pros of an HDHP are that you can have a lower deductible, and in some cases it can be quite substantial, where it can be anywhere from 50 to 100%, and that you have access to an HSA, a health savings account. That is a huge, huge one. And some medical expenses are covered under the HDHP. Now, if you look at healthcare.gov with the US government, they'll say that things like STI tests, colon cancer screenings over the age of 45, it says vaccinations, measles, mumps, kind of the standard vaccination protocols, type 2 screening, HIV screening, even PrEP, some of these medications can be covered even in a high deductible healthcare plan. But with a high deductible healthcare plan, you do have some cons. You could potentially, if you have a pre-existing health condition, be on the hook for more of a deductible. That means you're gonna pay more out of pocket. You're gonna have potentially less medications covered in your health insurance plan. And generally speaking, any visits you have to go see as far as urgent care or general kind of specialists, you're gonna be paying full price for those visits up to your deductible of, in my case, $3,500 for the year. So instead of paying a copay of 40 or 80, generally, you might pay an office visit fee of 75 to 300. And so you have to weigh in those factors. So how does the math look? Well, for me, looking at my numbers here, and I'm gonna look down here just because I wanna review them. If I had a PPO plan, essentially, I was paying around $600 a month for a PPO non-HDHP plan. And that worked out to around $7,200 a year that I had to pay just for my health insurance. And when I switched to a high deductible healthcare plan, that premium dropped to like $350. And that math dropped and saved me over $2,000. And my deductible went from $1,500 to $3,500. Now, I'm not saying this is apples to apples, but I don't spend $2,000, $3,000 a year on health insurance personally. I don't have any pre-existing health conditions. I'm healthy, I take care of myself, I exercise, I eat right, I manage my stress well, I sleep exceptionally well. And so personally, I don't have any pre-existing health conditions. I'm not taking any crazy medication. I might go to the urgent care occasionally if I get sick or need to be tested for some sort of bacteria type thing like strep throat, what have you. But for the most part, my expenses and the deductible, and then factoring in the fact that I can go in and do an HSA, it really made a lot of sense for me to shift over to using an HDHP plan. Now, talking about an HSA is beyond the scope of this video, but I do encourage you to check out the video I put up here. I'll link the video card and the description here. It's all about HSA accounts. You can learn about HSA. The maximum contribution limit for a single individual in 2023, I believe, is $3,850 for the IRS. And that is pre-tax money that you can defer into an HSA. And then it's also tax-free on the way out. So you can actually put it into mutual funds, into investments, grow it with no capital gains tax, no taxes, and then use those funds that were not taxed from your paycheck to then pay for your office visits, prescriptions. There's a whole list of qualified medical expenses, some things even like menstrual products. There's a great expansion of lists there of products that you can use it for. So let's just recap. There's a PPO, which is your traditional health insurance plan. There is the HDHP, which is a high deductible health plan. And there's actually called a HMO. The HMO, just a quick caveat, is basically a plan where you have a designated doctor. You cannot choose to go to physicians. You have to go see your doctor and then you work by referral. It typically has a lower deductible. It has copay, all that kind of stuff that you would see in like a PPO. But you end up kind of getting limited in the providers that you can actually use. You need a referral. And so it's a lower cost plan, but there's also more restrictions and it takes more time because you have to go see your general provider every time. You need to then go get a referral. If, for example, say you have a sinus infection, you want to go see an ENT, you can't just go look who's in your network and go find an ENT and go straight to them. You actually need to go to your general doctor with the HMO. So anyways, back to what we were talking about between PPO and HDHP. So preferred provider, traditional healthcare plan, and then HDHP, your high deductible healthcare plan. HDHP is qualified for an HSA, health savings account. That's where you get the huge advantages of using pre-tax dollars to pay for your health expenses. You want more customization, choice on where you're going to spend your money, or just more kind of purchasing power, really, right? Then the HDHP can be right for you. If you are coming in with a pre-existing health condition, you have a lot of medication costs, and you often have a lot of things going on in your health with doctor visits, maybe you're dealing with something already, then a PPO is probably the move for you. So it's really a cost benefit analysis between where you are in your personal situation and then what the costs are, because the deductible itself, for someone that's just healthy going through their normal lives, they're probably not going to get close to that deductible even on the PPO. And in that case, an HDHP probably makes the most sense because it's a much lower premium. You're keeping money in your pocket. Even if I was going to spend $300 a month, on health care, it would still kind of be difficult for me to catch back up and make it justifiable to be on a PPO. Then you start looking at HSA and the fact that you can do that with an HDHP, and now it's a really big kind of push towards that if you're healthy. So it comes down to your situation, your health, but for the vast majority of people watching this video, I'm assuming you probably are somewhat healthy and your healthcare expenses are going to be mostly benefited if you can put away some money on the side into a HSA account to grow that tax-free and use that money pre-tax to cover things that you want to actually spend money on for your health care needs. So if you have a pregnancy, there may be some situations here you want to look at. And also if you have surgery lined up, there may be some situations where a PPO is the better choice than an HDHP. All that aside, I'm going to give a quick plug again to that video for the HSA accounts. Check that out if you'd like to. And if you made it this far, thank you so much for watching. It really helps grow the channel if you hit that subscribe button and like button and you drop a comment below to kind of engage with the video since it's such a new channel. Thanks a lot, and I appreciate you all, and I will catch you on the next video.